Good morning. If you're tuning in, this is still KBC Channel 1 and you're watching Good Morning Kenya. On our interactive segment, we want to remind you that we appreciate your feedback. We're going to be talking about the issue of cancer under the uncertain times of COVID-19. Taking me through this discussion is Dr. Lalit Paradpande, an oncologist with a 10-year experience, to tell us the do's and don'ts on what to look out for, especially for those with predisposed issues, especially cancer. Welcome, sir.
Good morning. Thank you very much.
Now, well, let's just start off with the issue of if one does one's history of cancer raise, one's susceptibility or risk for COVID-19 or other complications related to COVID-19?
So, for per se, cancer patients on treatment are susceptible to various infections. And now with the advent of this COVID pandemic, they are more prone for developing serious complications because of the virus. So, they need to take adequate precautions for protecting themselves from the virus.
Mm-hmm. Now, especially we have quite a majority of Kenyans are dealing with the issue of the scourge that is cancer. Now, does this, or having gone through chemo or radiation, there's a lot of anxiety around that. Does that make me susceptible to COVID-19?
Yes, definitely. Cancer per se itself causes immunosuppression leading to susceptibility to COVID and other infections. And also the treatment, like you mentioned, chemotherapy and radiation, they can also further increase the susceptibility to develop infections and increase complications due to COVID.
Mm-hmm. How about you just elaborate what exactly do you mean when you say compromise?
So every person has an immune system in the body which fights infections. It's always acting all the time, unknown to us. So when you mean by immune suppression, it means that the immune system is lacking in some way. So it can be because of cancer, it can be because of various treatments like chemotherapy, it can be because of a patient undergoing a solid organ transplantation like a kidney or a heart transplant. So all these people are immunosuppressed, immunocompromised. Somebody with HIV/AIDS is immunocompromised. So they are prone to develop serious complications to simple infections. You and me with normal immune systems can fight any infection, but unfortunately not these people.
Mm-hmm. So they need to be careful.
Absolutely.
That's what I'm hearing
Yes,
from you.
they need to be extra cautious.
Mm-hmm. Now, should cancer survivors now adhere to the laid down public health regulations, or should they go a step further? You know, since we've already said that their immunity is somewhat compromised, then how then do they take care of themselves better?
So when you speak of cancer survivors, it means that the patient has already finished treatment and they're on regular follow-up with a doctor. So in the era of, the present era of lot of virus everywhere, they can avoid unwanted hospital visits, I feel. They can always inform their doctor regarding their health care, how they are doing, and once the virus goes away, then they can follow their regular follow-up schedule.
These ones are the ones, cancer survivors have already gone through treatment, yes. But what advice would you give those, impart to patients who are taking therapies like TKIs? I mean, should they proceed with them, or, should they stop or proceed with this cancer treatment?
So now it's advised that they continue with their oral, the TKI that you mentioned is an oral form of treatment, oral form of chemotherapy. So it's very easy to take the treatment at home. But when it comes to injection chemotherapy, then they need to decide whether they need to come to the hospital. Mm-hmm. So the oncologist is the right person to modify the treatment if required for a particular patient. So even in my practice, I have changed the treatment for some patients. Instead of giving them injections every 3 weeks or 4 weeks, I have put them on tablets with similar efficacy. Main reason being that they can avoid travel, get undue exposure to the virus and come to the hospital. Mm-hmm. So they can take the treatment at home.
Oral treatment at home, that's
yes,
okay.
Yes.
Now, if a cancer patient or a survivor exhibits or starts showing symptoms of maybe fever, cough, that is somewhat related to COVID-19, then who should he or she call first? A general practitioner or the oncologist?
He or she should call the oncologist first, and then the doctor can take a proper history from the patient, whether it is COVID-19 related symptoms or is it something because of the cancer or its treatment. Mm-hmm. Because not all fever and cough is COVID-19. It could be something else. It could be a pneumonia or some other infection. And based on the doctor's advice, the patient can either come for the hospital for testing for COVID-19 or be managed with suitable treatment like antibiotics, etc.
So first call is an oncologist.
Yes, absolutely.
Okay. Now, if what if a person now was about to start their cancer treatment and COVID-19 has happened? We've already seen from the reports, especially from the Ministry of Health, is that Kenyans are generally not going to hospital because of fear around COVID-19. We have someone who's about to start their cancer treatment. Would you advise that they postpone it? Or what happens in such kind of a situation?
So in certain situations where the treatment can be safely postponed or modified suitably to an oral form of treatment, that can be done by the oncologist. For example, a breast cancer patient has undergone surgery and we need to do chemotherapy and radiation. So instead of the injectable chemotherapy, there are certain situations where you can put the patient on tablets with the same efficacy. And once the virus goes away and things are okay, then patient can be started on the standard treatment. So there are scope for modifying the treatment suitably so that patient minimizes the risk to travel outside and come to the hospital. So that can be done.
There's been a question that has been asked, does smoking exacerbate or rather put someone are smokers more at risk of contracting COVID-19?
Yes, definitely, because most smokers would have some underlying lung disease, COPD or something. So they are at definite risk of getting more complications due to COVID-19.
Now, since we're talking about from a medical profession, COVID-19, does it have long-lasting effects of COVID-19 or is it too early to tell?
It's too early to say how long the immunity lasts. So we don't know if an infected person, he recovers, we don't know how long he is going to be protected from a reinfection. So we don't know how long the immunity lasts.
So it has also been said that COVID-19 can cause lung scarring. Yeah, and will this increase the chance of a person developing lung cancer?
It's very early to say so, whether COVID-19 would be a risk factor for developing cancer. It's too early to say so, because the standard risk factors for lung cancer are tobacco consumption, occupational exposure to various gases, etc. But whether COVID-19 causes, it's too early to say.
So what are the recommendations for, retesting COVID-19 patients, positive patients before starting chemo? We've said that there are times when you prefer to give, as an oncologist, you prefer to give oral medication. But now retesting of a positive COVID-19 patient to start chemotherapy. What
so
are the
patient with COVID-19 positivity, I would recommend that the patient finishes the treatment for COVID-19, which is more or less supportive care only. There's no known treatment for COVID-19. And once the patient recovers and his 2 or 3 tests are negative and his general condition is okay, then we can start him on the regular cancer treatment, not during the time when he's COVID-19 positive.
Okay, fine. Now, maybe you can give us the statistics of how cancer treatment in the country currently looks like.
So when it comes to Kenya, a population of 50 million, there are 47,000 new cancer patients happening every year and 33,000 deaths annually. So it's a huge number for a country with such a small population. And 70 to 80% of patients come in the advanced stage where cure is not possible. So that is because of various reasons like lack of awareness, lack of facilities, the fear and stigma associated with cancer and its treatments. So it's a multifactorial reason.
Now, you've talked about the issue of treatment, and one of the things that Kenyans who have taken survey about cancer treatment highlight is that the cost of treating cancer is far from the reach of ordinary Wanjiko. Why is it so?
I would agree with you because because treatment of cancer is complex. It involves surgery, chemotherapy, radiation. So chemotherapy, the costs are very high because most of the drugs are not manufactured in Kenya. They need to be imported from various other countries, and this adds to the cost of the treatment. And facilities for radiation are not available countrywide. The equipment the radiation equipment is very expensive. And also the insurance coverage, it's also very important that insurance covers each cancer and its treatment adequately. There should be it should not be lacking in any way. So,
yeah, okay, so the issue of how to actually get the treatment is why. Then what can we do? What can you advise from where you sit as an oncologist to individuals to boost our immunity, and just general health, especially during this COVID-19 issue?
So the best advice is to follow a good diet, exercise regularly, maintain your weight, don't be overweight, and eat healthy food, fruits and vegetables, and stop smoking totally, stop tobacco consumption, drink alcohol in moderation.
Oh,
So
drink alcohol in moderation.
Yeah.
Kenyans already complaining that the bars have taken too long to reopen.
Yeah, it's very difficult for a person to stop totally, I mean, tobacco and alcohol consumption, but alcohol in moderation is okay, but tobacco, a strict no when it comes to cancer and other diseases like diabetes, hypertension, heart problem. So, no tobacco.
We change our lifestyle.
Yes.
Yeah. Now, that would work on improving our general health, or rather our immunity system. But now, someone with comorbidities, hypertension, as you've mentioned, especially during COVID-19, then what should they, what should they do to ensure that, they put proper measures so that they do not fall ill?
So more than hypertension, it would be diabetes that would be dangerous for a particular patient, because diabetes is again a sort of immunosuppressed state, and it's a disease that affects the entire body. So patients with diabetes are more prone for complications due to COVID-19 and other diseases. So these people need to take extra precautions. What we all are doing: social distancing, hand washing, wearing a mask, avoiding crowded areas. So they need to do that more than the hypertensive patients.
Now let me take you back to the current status that we find ourselves in as Kenya. You've said those are quite a huge number of patients year on year, given our population. Now looking at the medical facilities that we have, the issue of having the right personnel, that is human resource, as well as the medical facilities. How do we compare within the region?
So unfortunately, most of the cancer-related treatments are in the major cities, Nairobi, Eldoret, and the other major cities don't have proper cancer care. So it's very important that there are regional cancer centers established throughout Kenya with proper equipment for using radiation, doing surgery, administering chemotherapy. So that's very important. So there should be a robust cancer management system in place in the country. That's very important.
So we're lacking.
Yes.
Now there's the issue of oncologists. Given the last survey that we had very few trained oncologists,
yes,
local oncologists practicing in Kenya.
Yes.
From your take, I mean, having a 10-year experience in oncology.
So lack of, as you said, lack of trained people is severely lacking in Kenya. We need a curriculum to be started in the country, right from the MBBS level. That's the basic medicine level, where there's an oncology course, so that the students are sensitized about oncology. Maybe at the school level itself, awareness about cancer, what is cancer, common types of cancer, and the basic treatment modalities, and then have a postgraduate degree and a super specialty degree in medical, surgical, and radiation oncology. So this is going to take some time for the whole system to be in place and be established.
There's debate about when the economy should reopen. Now, in light of issues of cancer around COVID-19, we've already established that people with pre-existing conditions are more susceptible to COVID-19. Now, looking at children and those who happen to be in the older demographic, 60 and above, this reopening of the economy would somewhat, make them more exposed. Then what do we do about these vulnerable ones, the children and the elderly?
So definitely, as you said, people above 60 are more prone for developing complications through COVID. So they need to take extra precautions. I feel they need to be more careful. Avoid going out of the home unnecessarily, avoid crowded areas, wear a mask.
So even when we reopen, that
yes,
you are advising that they still stay put?
Absolutely. They should follow all the current practices like social distancing, wearing mask, hand hygiene. More important for them. They should not stop it till the virus totally goes away, because we never know where the virus is.
Now, Dr. Lalit, cancer is something that is evolving, and we've seen it's not just, it's a global issue, not just in Kenya. There was a myth before that has been proven, not substantial. The issue that children, and cancer, we're seeing children also contracting cancer. Why do you think this is happening? You've said we need to adjust our lifestyle, but I'm imagining alcohol, tobacco, this is not for children. What is happening?
So most of the cancers are sporadic, that it occurs randomly in the public, and only few cancers can be familial, that is genetic. So cancer in a particular child need not be a genetic or
issue
passed on from generation to generation. It's just because of a genetic change or some other reason that the cancer has developed in a child.
So there's been a debate on, or rather people have felt, especially those who've gone through, cancer treatment, that use of chemotherapy, actually those who went and go for chemotherapy do not survive, whereas those who go through radiotherapy live to tell the story.
No, it's not. What you bring out is a very important issue. There's a lot of myth, a lot of fear regarding chemotherapy, not in Kenya, back home in my native India also people fear chemotherapy because of various reasons. They think chemotherapy is very painful. They think chemotherapy will cause severe side effects and the patient will not survive. It is not at all so. So, chemotherapy is not at all painful. It is just another medicine that is given either orally or intravenously, just like an antibiotic, but you need to take few precautions. And there are a lot of improvement in supportive care. So, previously patients used to fear severe nausea and vomiting after chemotherapy. So, now with the advent of good antiemetics, that no longer happens. And the major side effects of chemotherapy like fall in the leukocyte count no longer happens because of the growth factor injections that we give following chemotherapy. And there are a lot of advances in chemotherapy for each cancer. We are in an era of targeted therapy. So, what I mean by targeted therapy is that the treatment is going to affect only the cancer cell and not the normal tissue. That way the side effects are minimized. And it's not that radiation doesn't have any side effects, even radiation can have acute and chronic side effects. So, it's not that treatment is.
It's not assured that
correct.
If you do chemo or
Yes.
either, depending on maybe the
exactly.
advance, and also the body itself in terms of its
Absolutely.
immunity. Now, what about the antibody testing as a mode of testing for COVID-19, especially around cancer patients?
So, what is recommended for COVID-19 now is the RT-PCR, the antigen capture assay, not the antibody, because not every patient might have an antibody response. So, that is not recommended. It's only the RT-PCR based test that is required to prove or disprove whether a patient is COVID-19 positive, not the antibody test. Yeah. And tests are evolving by the day. I mean, every day something new comes, new testing is coming up, new drug is coming in COVID-19. So, it's a very fluid situation.
Now speaking, I know you're in the medical field, and there's been a lot of questions, especially about how we are going about doing this testing, especially for COVID-19. Kenyans have said, or those who have been tested have said, it's quite an ordeal, and I've asked, why do you have to put the item all the way through the nostril or the mouth? Maybe you can explain. I know you're not you're an oncologist, but maybe you can just enlighten why do we have to go that deep into a nasal tract?
I mean, it looks very fearful when we actually see it, but it's not so. I mean, that's the way we get the proper sample for testing.
Then someone asked, then couldn't you get it from the blood? I mean,
from the blood, the tests have been done, but the current tests only recommend the nasal swabs, unfortunately.
So we can't
Yes.
go around that. So looking at what government has been put in place and talking about issues of universal health care, and now focusing on the issue of cancer. From an oncologist point of view, we've already said that the treatment is quite expensive, because of the facilities and all that stuff. Do you think cancer treatment should be also incorporated in as far as universal healthcare is concerned?
Definitely. Cancer is an epidemic in Kenya and other parts of the world. So, affordable cancer, accessible cancer treatment should be part of the national health system. That's really important. Having said that, it's very heartening to note that there was a recent survey conducted by WHO, where they found out Kenya was the country with the highest awareness of cancer. So, it's very good to know that Kenyans are aware of cancer. They know what is cancer, what treatment has to be taken. But we need to provide them good treatment facilities, affordable and easily accessible. That's very important.
Talking about accessibility and affordability, we've seen those Kenyans, or rather locals seeking cancer treatment, opt to get their services abroad, preferably India. I mean, having worked there, that's your home country. I mean, what has India done that Kenya should do to ensure that we treat our people locally here?
So, what Kenya should do is to have comprehensive cancer centers in major cities and big towns in Kenya. Have a system where a primary physician or a general physician, family physician can identify signs of cancer. The main reason that the outcome of cancer is poor because patients are not diagnosed early and they come to the oncologist very late where treatment is not possible. Almost every cancer can be cured when the patient comes early. So, training people at the village level, at the grassroots level to identify the signs and symptoms of cancer so that the quick referral happens to the oncologist should happen. setting up of hospitals with full-fledged cancer equipment like radiation, surgical, medical, access for chemotherapy. So many drugs are not available in the country, they are imported, as I said earlier. So they need to be made in Kenya, so that the cost also come down as a result of that. So we can definitely prevent our patients from going to India and abroad. We can definitely do our best here.
If we invest as we should.
Yes.
Now, there's the issue of recurring cases of cancer. Like you beat cancer 2-3 years on, it is back. Maybe expound on that issue.
So that's sad part of treating cancer. As an oncologist, I feel very frustrated when my patient comes back with a relapse. So any cancer patient has a risk of relapse. That is because of the inherent biology of the disease itself. So they might get the same cancer again, or they might get a different cancer. And sometimes the treatment of cancer also can cause a second cancer. So few chemotherapy drugs can make a person susceptible to cancer. So that is the reason relapses happen.
Now, we just want to sample some of the feedback that we were asking, because we have asked Kenyans to just give their feedback in regarding to cancer. So there's someone who's texted in and asked that I was about to start, or rather I'm going through cancer treatment, a combination of chemo. I opted for radiation after chemo. During COVID-19, should I still continue the treatment?
Yes, as long as it's possible for you to go safely to the hospital, I would suggest that the treatment be continued, taking all due precautions. That's very important.
Maybe that comes up to the issue that we had asked, the issue of do you postpone treatment where possible, or do you start?
So for chemotherapy, at least we have the option of using oral medicine, but for radiation, there's no other option. So if radiation is definitely part of that cancer treatment, then it has to be done, taking all the precautions. For the chemotherapy part, oral form of treatment which can be taken at home can be done.
Now, also, are people who are on endocrine therapies like breast and ovarian cancers more at risk of contracting COVID-19?
Which patients?
The ones with breast cancer, ovarian cancer.
Any patient for that matter, any cancer patients. But among the cancer patients, the patients with acute leukemias, where the immune system is really bad, they are more prone for COVID-19 and other infections, the acute leukemia patients.
Now, just in a nutshell, going forward, because cancer, as it is, you've said it has very different forms of treatment. But now we're talking about it in a general kind of way. Now, just looking at how you can just give us into detail what we can do. I know you said we avoid tobacco and alcohol, but what else can we do, especially now for the young children? Yeah, you said it's right. What can we do to enhance their immunity, or rather their immune system?
So for cancer like cervical cancer, there's an effective vaccine that is available. So it's recommended that girls from the age of 9 onwards to 9 to 16 get vaccinated for the human papilloma virus, which can protect against cervical cancer, which happens to be one of the most common cancers in India and other parts of the world. And for the other cancers, there are effective screening modalities also available. Like for breast cancer, you can do mammogram. For cervical cancer, pap smear. For prostate cancer, there is PSA testing that is available. So there is scope of detecting cancer early, and also knowing the warning signs of cancer, like severe continuous headache and vomiting, difficulty in swallowing, chronic cough with blood-thin sputum, bleeding, abnormal bleeding from any side, any lump in the body, a change in a skin mole, which can say it's breast cancer, and all these signs, severe weight loss, loss of appetite, these are all warning signs of cancer which every person should be aware of. And also for breast cancer, to prevent breast cancer, self-examination is advocated, monthly self-examination by the woman, meeting a physician every year. So all this can be done to detect cancer and reduce the burden of cancer.
Stage. You've mentioned something about the HPV virus. It was very controversial with sections of the community, namely the religious sect, saying that this vaccine was not safe, and that actually it led to population. It was a chemical population. Trying to just manage the population. Now, from an expert point of view, being an oncologist, would you recommend the HPV vaccine?
In my opinion, it is a safe, completely safe vaccine and has to be given. The only common side effect is some pain during the vaccine, which goes away within maybe 15 to 20 minutes. Otherwise, it's a safe vaccine with no long-term side effects. because the vaccine has been placed for many years and studies have clearly shown that it is effective and safe. So definitely no issues using the vaccine.
Okay, we've addressed the issue of accessibility and affordability. Now, in a nutshell, and as we wind up all this, would want to know from where you sit as an oncologist, what as an oncologist, as a medical expert, what have you done to ensure that your patients continue receiving at least affordable, affordable cancer treatment, and also accessible, it remains accessible during this COVID-19 situation?
So during my practice here in Kenya, I have used medicines that are available in the hospital, available in Kenya as such, and I have modified the treatment from injections to tablets that I mentioned before. Like for breast cancer, I would put them on hormonal therapy tablets. For lung cancer, I would put them on the TKIs that you mentioned initially. So I have modified treatment so that the patient can take them comfortably at home. And I also told my patients that they can contact me on phone or on WhatsApp, and then they can send me the reports. Main aim is to avoid unnecessary visit to the hospital. Only when it is really necessary, then the patient has to come to the hospital and see me.
Now, that's that. But now, in a nutshell, do you think that, cancer treatment has been adversely impacted or by COVID-19, the situation that we have?
Yes, I think it has been adversely affected, because there's fear in patient's mind that if I come to the hospital, then there might be other COVID-19 positive patients and I might get the infection. Also, when I'm traveling to the hospital, that there is a risk that I catch the infection. So the number of patients seeking cancer care have come down definitely.
Now, the issue of stigma, especially in society, how do we address that?
So treatment has to be continued. I mean, there are certain situations in cancer medicine, that cancer practice, that we cannot stop the treatment. It's very urgent. Otherwise, the outcome is going to really differ a lot if we delay the treatment. So in those situations, after taking adequate care, patients do have to take the treatment.
Now, there is a viewer here who's asking, if I go for cancer treatment, will I lose my hair?
Yes, that is the biggest fear for a woman, especially women, when it comes to chemotherapy. So there are few chemotherapy drugs that can cause definitely alopecia, that is hair loss. And there are few drugs that don't cause. So if hair loss is a concern, then the treatment may be modified accordingly. But most of the time, what I advise my patient is, please take the treatment. The cancer will go away, the hair is going to come back again after some time. It's not that it's a permanent hair loss, it's going to come back.
So it depends on the treatment.
Yes, definitely.
You do not necessarily have to lose your hair.
Yes.
Now, the other issue that has come up is the issue of, this is also related to, the physical reactions to chemotherapy, the issue of body weight, extreme loss of body weight. Then how do we recoup? How do we get back to a normal body weight after, especially for cancer survivors?
Body weight is a symptom and sign of cancer, for usually advanced cancer. So like example, advanced pancreatic cancer, where patients lose almost 30 to 40% of their body weight. And also because of treatment can cause temporary nausea, vomiting and loss of appetite. So main aim is to have frequent small meals, have carbohydrate rich meals, have food with lot of protein like a boiled egg. It's very cheap and good to eat. So and having a light exercise regimen. So doing that, the patient's weight is maintained, and with effective cancer treatment, actually patients on the contrary gain weight. When they are responding to the cancer, they are going to feel better, they are going to eat better and gain weight.
Now, you've already expounded on the issue of, how smoking makes one predisposed to contracting COVID-19. But now, what's, the relation between COVID-19 and cancer from an oncology point of view with our lifestyles currently?
So whether COVID-19 causes cancer is not known. It's going to take studies running into years together to know whether COVID-19 predisposes to someone to cancer. But a patient with cancer gets COVID-19 is at risk of developing serious complications due to COVID-19.
So in a nutshell, where do we stand as Kenya? You've said that there's a lot that needs to be done. We're expecting our budget in the next few weeks, or rather one or 2 weeks. What would be your expectations, especially for the health sector, coming from your profession as an oncologist?
In regards to the vaccine?
In regard to the steps that Kenya needs to take to just beef up, cancer treatment, accessibility and affordability.
Yes. So that will take it's going to take an all-around effort to do that, I feel, right from the government, the public-private cooperation should happen, and it's going to take some time for things to improve, I feel.
So do you think Kenya poses or rather stands an opportunity to actually become, an epitome of cancer treatment, especially within the East African community?
Definitely. I think Kenya has to do it. I mean, I would say there's no other option. We have to do it to fight the cancer epidemic. There are so many cancer patients in Kenya, and we need to do the best for them so that they're back to their lives, back being normal. That's very important.
Now, in a nutshell, since we're during this issue of COVID-19, and you definitely have patients that you've handled, someone who is really worried about their current situation being either they've just found out they have cancer, and they're not so sure if they should start the treatment. Secondly, there are those who are already under treatment and they're not so comfortable. They don't know what to do. As we come to a close, advice to those potential clients who've already gone through this treatment or about to, then COVID-19 happened.
So I think it should be on an individual basis. We need to see what cancer has been treated, what treatment is given, what is the urgency of the treatment, and also to give a sense of confidence to the patient that it's not such a fearful situation out there. You take adequate precautions, wear your mask, don't go to crowded areas, practice social distancing, then you can be safe and continue your treatment. Continuing treatment is really important.
So for someone who's gone through cancer survivor, if they get these symptoms, fever, cough, they call the oncologist?
Yes,
first.
They call the oncologist.
They call the oncologist first, then they can proceed to find out if this is COVID or just another ailment.
Yes, because apart from COVID-19, there could be some other problem. It could be some other bacterial or fungal or some other viral infection that the patient could have.
Now, I've been speaking to an oncologist, that is Dr. Lalit Paradpande, just trying to look at the issue of COVID-19, but through cancer. Cancer and its correlation to COVID-19. Is there a correlation or not? And what should cancer survivors do, or those with comorbidities do during this time? And say that you have to be a little bit more careful because you have a compromised immune system. So do adhere to the public health guidelines, and if you present a few signs, maybe high fever, coughs, and you've either were to start your cancer treatment or you've already undergone it, that the first person you need to call at this time is your oncologist. Dr. Lalit, what can we say? Namaste.
Thank you. Asante sana.
Oh, asante sana. That is nice. That is Dr. Lalit Paradpande, who is an ESMO, European Society for Medical and Certified Oncologist, for the last 10 years, giving us, or rather sharing his thoughts about, cancer treatment during these uncertain times of COVID-19. Doreen, what do you think about steps that have been made to ensure, or rather to assist, or rather Kenya, the strides that has made towards cancer treatment? Do you think we're on the right path?
Well, I think it's very important even as we talk about matters cancer in the country, given the fact that during this.
Okay, fine. I will get back to Doreen. I'm just continuing to ask you, what you think about the issue of cancer treatment in light of COVID-19. Remember, my Twitter handle is @RayManyara, and we've just been sampling just a few of your messages on our social media platforms, and one of them is one who questioned and asked if they will lose hair if they underwent chemo radiotherapy. And our guest this morning, that is Dr. Lalit, explained that this is a fear, especially to the women folk, saying that varies between, the medicine that is given.
It depends on the medicine that has been given. And this fear prevents many women from taking good, adequate cancer treatment. So that's a big stigma in the women. If they don't want to lose hair, and for the same reason they don't take treatment. So this is something that affects cancer treatment. The fear of hair loss. Correct. But now there's also the fear highlighted on losing the breast. That is something that most women say, cancer survivors say that was the hardest thing for them to go through. So there was a time where the entire breast used to be removed. That is called mastectomy. With the advent of breast conserving surgery, only the lump can be removed. So you no longer remove the entire the breast. Only the tumor tissue is removed along with normal tissue, normal margin. So that is called a breast conserving surgery. and the outcomes of breast conserving surgery and mastectomy are the same. It's not that if the entire breast is removed, the patients are better. It's not like that. So both groups do well, and with breast conserving surgery, that is BCS in short, the quality of life is much better. There is no arm edema, and it's a sense of fullness in the women. They feel really happy when it comes to BCS compared to doing a complete mastectomy.
Now, this is just me wanting to find out, persons who go through cancer treatment, do they also get aftercare support, especially, to deal with the trauma of going through the treatment, may it be radiotherapy or chemotherapy? Do you advise that they seek even, counseling and such? While recovering, counseling to just, it must be a harrowing experience, the loss, you might lose your hair, you might lose some,
Apart from loss of hair, there are a lot of other difficulties that are cancer patients, because the whole experience of being diagnosed and being treated, it can be very overwhelming for the patient and for the family, especially if the patient is a caregiver and the breadwinner. It's a very difficult situation to be in. And also when it comes to a relapse, can be very heartbreaking. So adequate social support and counseling and family support is required in managing cancer.
Very well. Thank you very much. Namaste.
Thank you.
Karibu tena. Now, Doreen, I guess you can hear me from the other side of the studio. What do you think about the issue? But before we get to hear to Doreen, about Doreen's feed, or rather take on this issue of cancer treatment during the times of COVID-19, how about we sample some of your views that we received on Twitter? Now, that is a difference. Kenya needs to focus on cancer prevention and treatment with some charisma as they are handling COVID-19. Cancer is killing so many Kenyans daily. You agree with that, Dr. Lalit?
That's a very good point that has been noted by the viewer.
Yeah.
We should focus on cancer management as on the same lines as we are doing for COVID-19.
So it can be done for cancer.
Yes.
Any other tweet? Okay, fine. We'll still be loading. Here's another one at Ashon on Twitter. I wish we had more zeal to fight cancer in our society as we're dealing with COVID-19 virus. More zeal.
Exactly.
Kenyans calling and viewers calling in and saying, just having the feel that we have really focused on COVID-19, we should put up more efforts to cancer.
Cancer and other infectious diseases that are plaguing the society, that's really important.
Not just COVID.
Not just COVID.
Okay, any other tweet? Let's sample one more. There. At the Kenyan Spectre, approximately 1,200 people die daily from various diseases, and we have never bothered. 100 die from cancer daily, and we still are never bothered. That's a concern that maybe we are overlooking a few diseases here and there as we go. There's also a report showing that Kenya, even despite being in the 21st century, we're still losing people, scores of people actually to malaria, a tropical disease that was here before colonization, and still 21st century, we're still tackling malaria. So, more feedback? The last one, that is at Moses Mbura. If the world will come together in the way COVID-19 has forced it to, a collaboration of oncologists would produce cancer drugs in months. True? Do you think so?
It's such a valid point. I mean, we must focus on things that really bother us as a society. Cancer treatment, malaria, diarrhea, infectious diseases, tuberculosis, HIV/AIDS. I mean, it's more than COVID-19. We must do as doctors, as general society, as government, we must take good care of all these things.
Well, I think in my opinion, the reason why we have so focused on COVID-19 as a world is the issue of the mortality rate.
Yes.
There's such a short term, we're losing people in under 2-3 weeks, and I think that is what has us on a panic globally. So I think if we all came together, as you said, researchers, governments, private sector, we would indeed, arrest this scourge that is still cancer. Yeah. Thank you very much for having kept us company all the way from 7 a.m. till now. We'd want to say that tomorrow is also another day where we get to discuss issues, pertinent issues that affect you and I. Remember, stay home, stay safe. I'm Regina Mayara Gital. Have a pleasant day ahead.